Good morning, everybody. We might get started. My name is Flynn, and I'm the Research Development and Policy Manager for the Community Services and Health Industry Skills Council. And thank you all very much for coming along today to our Skilling Up for Oral Health Workforce Forum. We're very pleased to be able to be conducting this forum as part of a project that we're currently running on looking at developing oral health competencies for the broader community services and health workforce. And that project itself, I'd just like to acknowledge we were able to proceed with through a program established by DEWA, the Commonwealth Department of Education, Employment and Workplace Relations. It was through their Workforce Innovation Program. And I'll speak a little bit about our role as an Industry Skills Council and as with our role in terms of developing the national qualifications and competencies, but this project has actually enabled us to go beyond what we would normally do or be able to do or have the capacity to do in reviewing our training packages and qualifications, and really take a close look at innovation in workforce, focusing on the area of oral health, which is an area that perhaps doesn't get as much focus as it probably could in the health and community services industry. So again, we're very pleased to be able to have progressed with this project. In terms of this forum is part of the project, and I'll speak a little bit shortly in this morning's session about what we're doing with the project. But again, the forum is part of promoting the stages of the project and its outcomes, and also the forum today, again, as part of the project, we've invited a range of speakers in the oral health area and the broader community services and health industry to have a look at some of the issues and the ideas around expanding oral health service delivery. So you'll see in the program today we've got some 3 sessions, one on national perspectives with representatives from the major employers, the private and the public employer. We've got a second session on innovation looking at aged care, and a final session looking at rural and remote service delivery, which is one of the key areas that we think we could see some great outcomes for expanded oral health services. And our final session will be facilitated by our technical research consultants for this project, where we'll look at the progress we've got to date, looking at, well, what are some of the competencies or skills that the broader health and community services workforce could be using, and what are some of the community services and health workers broader than the oral health sector that could be deploying these skills. So we'll really hope to be getting to some good practical nuts and bolts in that session. Now look, I would just like to give you a brief introduction, I'll try and be as brief as possible, about the Community Services and Health Industry Skills Council and what we do before we get on with the formal program. So for those of you who don't know, the Community Services and Health Industry Skills Council is one of 11 industry skills councils, and we have a mandate to provide advice to the Australian Government about skill needs in the community services and health industries. We have our mission statement here on the screen, and that states that we would like to be able to see that the community services and health workforce is as competent as it could or should be to meet the community services and health needs of the community now and into the future. Just a little bit about the context of skills and the workforce. I've got some of the 2008 data on the board here on the screen, and you'll note that the community services and health industry, in terms of the headcount last year, was 1.1 million workers. We have some fairly large cohorts in that group, registered nurses and nurses' aides and personal care assistants, childcare workers and so on. You might see in there as well that the age of the workforce is higher than on average. So in terms of our workforce growth, we are the fastest growing Australian workforce, and the graph here again from the 2008 data shows that as of 2008, we needed 160,000 new workers over the next 5 years. And that was about the third year in a row that community services and health had needed to grow faster. Now, just this morning, I got some of the new data, and this is from August this year, and the ABS Labour Force Survey, and these figures are collated by DEWA. And I'll just point you to, well, firstly, in the space of a year, we've seen over 100,000 new employees added to the health and community services workforce. And some researchers who brought this initially to our attention thought, hang on, is this wrong? That seems to be a lot. So we'll see. So we've got over 100,000 new workers and a growth rate of 9.4% over the last year. And indeed, the community services and health industries are now the largest Australian employer. We've recently pipped retail. So that growth is really exponentially developing and expanding, and so hence the importance for us to be really looking at, well, not only growth of the workforce, but the configuration of the skills of the workforce to meet those needs. We really do need to be thinking about that. Again, particularly when we look at some of our large cohorts of workers who are older, a lot of them are going to be retiring and may not necessarily be replaced by the university or the VET sector. Again, in terms of what the Industry Skills Council does, we set the national qualifications and competencies within the vocational education and training sector. So I'll just speak a little bit about the AQF, or the Australian Qualifications Framework, shortly. But what that framework tells us, or what that framework shows us, is, well, who's in higher education, who's in vet, who's in schools. The figures that we have here show that about 50% of workers in the health industry have a degree, about 20% in community services have a degree. Vocational qualifications are about a quarter in health and 46% in the community services industry. And we have 28% in total who don't have qualifications. We just like to emphasise those figures because it indicates the qualifications that we do produce in the vocational sector do have a really significant reach. So of that 1.2 million workers, based on this breakdown, we are looking at the packages covering the work roles of both people who don't have a qualification yet and those who do have a VET qualification, as covering, well over 500,000 workers.